Hi, this is Rod Rohrich. Welcome back to Rohrich Knose podcast, helping you become a better you. So we always talk about plastic surgery and rhinoplasty, but what about revision rhinoplasty, and how does that differ from a primary rhinoplasty? So today I'm going to talk to one of the world experts on revision rhinoplasty, Dr. Drs Toriumi from Chicago, and we're going to talk about how rhinoplasty is so complicated and how revision rhinoplasty is so different than primary rhinoplasty. Dean, welcome. How are you?
Hey, Rod. Pleasure to be here.
Great. So, Dr. Toriumi and I, we lecture a lot around the world, and he truly is one of the true experts in rhinoplasty and especially in revision rhinoplasty. And there's only a few true revision rhinoplasty experts in the U.S., and there's only a few around the world. And so we're gonna take a deep dive, and this is gonna help you become more informed and more educated, because I see so many patients like you do, Dean, every week that had a rhinoplasty and they say, I just wish I had done my homework. I find that the revision rhinoplasty patients have really done their homework, but they probably should have done their homework before they had the first rhinoplasty. So what is a revision rhinoplasty, Dean?
Revision rhinoplasty is a rhinoplastic procedure that's performed on someone who underwent a prior surgery, a prior rhinoplasty. And so basically we're repairing maybe something that didn't go well in the first operation.
Right. So when you have a patient call you, what is the earliest time that you could consider doing a revision rhinoplasty or a redo nose job?
Well, that's kind of it's an interesting question, because people say you have to wait a year.
Right.
In my opinion, it depends on what the problem is. Okay, if someone had a rhinoplasty and they have a small irregularity on the bridge of their nose that maybe needs a little rasp, likely over time that's not going to go away.
Right.
So I don't want to have the patient sit there for a whole year with that irregularity. What we can do is, in a small incision, you could even do something under local anesthetic, put a little narrow rasp that we have available to us now, and you can just file it down. And you could do that as early as 3 months, I think.
Yep.
Now, if you have a tip problem, in that situation, I think you need to wait at least 9 to 12 months. I think you need to let the tissues settle down, kind of normalize the vascular supply, get rid of all the edema, and have everything stabilized. And at that point, I think you can go.
Yeah, no, I agree. And every patient's different. Sometimes if they have thick skin or a lot of scar tissue, you have to wait till it softens. So what do you think is the most common cause for patients having or wanting to have a revision rhinoplasty?
I'd say over the last 2 years, it's clearly nasal obstruction. I mean, I am shocked at how many people now, we give them a survey and we ask them, to rate what your complaint is, whether it's more aesthetic or more functional. And I'd say greater than 50% of the patients now have 50% of aesthetic, 50% functional, or the majority functional. And if you look in their noses, you can see why they're having a problem, because the lateral wall of the nose is collapsing in and they can't breathe. And you do a little maneuver where you lateralize the lateral wall of the nose, and suddenly they breathe well. They go, my God, if you can do that for me, I'd be very happy. And so, unfortunately, the aesthetic stuff is still there, but the incidence, I think, of functional problems is increasing.
Which is very unfortunate, because to us, that's you have to do both. You can't just fix the nose looking, you got to make it function well. So why do you think there's been a dramatic increase in that? I've seen that as well. Probably not as high as that, but it's certainly a lot higher than it used to be. What do you think's changed? Are we teaching things different today that people are not learning?
Well, I think part of it is because in these chat rooms and things, they talk about, if you have a breathing problem, you want it fixed, go to Chicago. So I think that has something to do with it. But I do believe that if you look at some of the techniques out there now, they're not really focusing on stabilizing the valve as much. I mean, people are using fewer spreader grafts. They're using, spreader flaps. They're doing things that aren't necessarily supporting the lateral wall. If you use a rim graft, it supports the external valve, but it doesn't support the internal valve. That's why my preference is to use lateral construct grafts that Dr. Gunter gave to us. Mm-hmm. And lateral construct grafts go right over the internal valve. And that's why I think they have more utility, at least in my patient population, for correcting and stabilizing nasal function. I use it in primaries. I use lateral construct grafts in probably 80% of my primaries. And, people say to me, well, why do you do that? I don't think that's necessary. The reason why I do it is because I give a nose questionnaire and a schnoz questionnaire to all my patients. And I found over the last 15 years that if I support that area with a lateral construct graft, they breathe better over the long term. And I'm not talking 6 months or a year. I'm talking about 3 years, 5 years, 10 years, 15 years.
Yeah, no, I agree. I mean, I don't use lateral construct grafts obviously nearly as often as you do, and obviously it depends on the patient and the nose, but I agree. I mean, you need to pay attention to the internal and external nasal valve, and I think sometimes people are not taught to do that, and then it becomes a problem long term. And we see those things long term, and we follow our patients and we go, wow, that really didn't work well 5 years ago. So what do you tell your patients about when they'll see the final result from a primary rhinoplasty? Like if it's your patient, you say, okay, when is it done? Because they come in, like I saw a patient today, she's 9 months out, and her tip is still hard. I mean, she looks good, but she said, when is it going to finally soften?
I really, tell patients, your nose will heal over the rest of your life. I tell them your nose will be 30% healed at a year, maybe 45 after 2 years. And then they ask me, well, when's it done? I go, if you come back to me in 25 years and I see you at 20 years, your nose will be different in those 5 years. So it doesn't stop changing. Now, maybe we don't call that healing. Maybe we call it just changes over time. They're not necessarily a complication, but things tend to move medially. The skin will contract a little bit. You'll get a little more definition. So, when that patient comes to you, Rod, at 9 months and says, well, things still don't look quite right here, I would tell that patient, you're not done healing. You're only probably about 25% healed, and you're going to continue to improve over time. And when I look at sequential photographs, I see my patients long-term all the time. 1 year, 5 year, 15, 20, 25 years. And when you look at what happens, the nose tends to become more defined. Now, the other thing that happens is the lateral wall comes in if it's not well supported. And that is one of the reasons why I did, transition over to using lateral construct grafts very frequently, because now I don't see as much of that medialization, but I do see improved definition. And somewhere on the internet, it's out there that your nose is done healing at a year. And I totally disagree with that. I think there's a lot that happens after a year. And that's really important to keep in mind.
I totally agree. But, you and I are a total minority on that, because I tell them, in a primary 12, 15 months, sometimes longer, depending, especially if they have thick skin. But you're right. They say, well, it should be done in a year. Well, that's not true. And for a revision, it takes double that time, at least. Right. So, I mean, but I can tell you that's, of course, Dr. Google's not a doctor and they're always wrong, but, I hear that all the time as well. So it's kind of like you're holding their hand and saying, hey, you're not even 50% there. So, but, I mean, that's good to hear. And I think that's good for the viewers to hear too, because, it's really, the nose takes probably the longest of any organ to rebuild and restore and just get the final shape and contour. And you're right, I see my patients long-term too, and it's a while when they come back at 5 and 10 years, and not only do they droop, but they can have other issues too, like you said, with functional problems. So
the other thing, Rod, is patient will come in for revision surgery, and they'll say, well, how long is it going to take for my nose to heal? And I tell them, 30% a year, 45% at 2 years. You go, no, it really didn't take that long. It shouldn't take that long. I go, well, think about the nose job that you had before you came to me. Think about what your nose looked like at 6 months. think about what it looked like at 2 years,
Right.
and tell me what it looks like now at 5 years. Didn't it change? And did it change over the last 6 months? Invariably, they say, yes, it got worse. So then I tell them, well, that's the healing process. And that's why I'm telling you, your nose will not stop healing. It will continue to heal over your lifetime.
Yeah. No, I agree. I totally agree. And yet it takes so long for patients, even if they had a rhinoplasty, to understand that, because they think it's like magic, that it's going to happen again. So, and especially with revision rhinoplasty. So let's talk about, okay, so how do you prevent this problem from happening? How do you tell us how you find a real, true rhinoplasty expert and obviously nobody's perfect, but if you find somebody that does rhinoplasty a lot and is good at it, how do you find that person?
That's a real tough question, because, I think a lot of patients, the first thing they do is they go to social media.
Right.
So I think social media is good in a lot of ways, because, like, for instance, on my Instagram, I show patient photos. So patients then come in and they go, I like this nose you did. I like this nose. I like your general aesthetics. So they understand what my aesthetic sense is. And so if they like it, they come. If they don't come. Part of the problem is a lot of the information they glean on social media, a lot of the information is, in my opinion, not correct. And so that's why you have to really be careful and talk to the experts and ask them, well, what do you think about this? What do you think about that? Because there is a lot of misinformation, like, when the nose is done healing. That's a perfect example. The nose is not done healing in a year. But when you want to pick a surgeon, I think experience is the bottom line, okay? Particularly with revision rhinoplasty. Revision rhinoplasty is exponentially more complex than a primary. Primary, you go in there and you pretty much know what you're going to do. You know what the anatomy is. With revision, it's like a Cracker Jack box. You don't know what your prize is going to be. I mean, I open the nose and I don't even bother thinking about it, because I know it's not going to be probably exactly what I think. So I psychologically, mentally have to be completely prepared for any deformity, because once that nose is open, I have to fix it. And so that's why, if you've seen hundreds of different combinations of deformities and you treated them over 34 years, then you have a lot of experience. And then you also follow your patients long term, so we know what the outcomes are with the different techniques. So it's a combination of careful diagnosis, pre-op, intra-op is even more important, identifying the deformity, and then having effective techniques to correct it. And then you have to execute. You have to execute very precisely to give the patient the best outcome.
I agree. It's the 3 E's: experience, like you said, expertise. You have to be able to deliver a product, and then your performance. Give excellent results and be consistent and show them long term. And you're right. Social media can be very deceiving, because the person that has all the flashing and the dancing and all the stuff and showing all this stuff intra-op and all stuff, I mean, that isn't as meaningful as showing. I mean, I like to show early, middle, and late term results. I show videos of patients early, and I show them late, and then I show photos too. And I think people will get a sense of, do they like your aesthetic, like you said. And you show primarily really longer term photos of your patients, and I think people appreciate that, because they can relate to that. And so social media is a very powerful tool today, but I think it's abused many times, and the public doesn't understand that. So I think that's a good question.
I think one thing that the public doesn't understand is that you and I are human, Rod.
Right.
And sometimes our results don't turn out great, but our vast majority do. So what's interesting is, like, you go to one of these rating sites and I'll have 10 5s, and then I'll have one unhappy patient, okay? And that patient will have this terrible whatever about their experience, and they all focus on that one. They don't focus on all the really good ones, but they focus on that one.
I know.
And it's really unfortunate, because I'll admit, sometimes I'll do a case and it doesn't work out, but I always want to bring the patient back.
Same here.
Fix it. Okay. I want them to come back. But if they don't come back, my hands are tied. I can't correct the error I made or the suboptimal outcome that was created. But if the vast majority of my patients and your patients are happy, then chances are, if that person who's looking on the internet for a surgeon comes to you or me, then they're probably going to be one of those happy patients.
Yeah.
I mean, you got to go with the odds. But we're gonna have an occasional situation where it doesn't work out.
Yeah, and I agree. And you bring that up. I mean, we all have them. In fact, if you see somebody's reviews, whether everything's a 5 or whatever, they're not truly. They haven't done enough. They haven't had enough experience. Believe me, we all live in glass houses, and you're right. And we want these patients to come back, but some of them, they just would rather talk about it than come back to you, and that's just part of how it works. And it's very frustrating to me and you. I mean, we see that too. And but I think that's a sign of a good surgeon, and I think people need to know that. So when you're looking at reviews, it's a cumulative effect. Look at it all, because if everybody has a 5, to me, that's a red flag, because sometimes they're, manufactured reviews. And that's
the other thing, Rod, is, we get really bad cases. I mean, you get cases where the noses are terrible. I have some slides that we can show of patients, like one patient who had a necrosed columella from combination lip lift with open rhinoplasty. And I did, more than 4 operations on that patient with a nasolabial flap to correct it. But it took, 5 operations or 6 operations to fix her.
Right.
Now, it's not something you can do in one surgery. So the patient, fortunately, stays with me. She's very, very, has tremendous confidence in me, and now she's very happy and she's doing great. Yep. If a patient starts the process but doesn't finish with me, then I can't get her to where she needs to be. And so that's where, I think when you work with a surgeon and the surgeon is willing to work on you to get you to where you need to be, the best thing to do is to stay with that person and let them fulfill, their goal, their pact with you to get you where you need to be aesthetically and functionally.
Yep, and that's very wise words, because, you and I have done thousands of rhinoplasties. I've never done a perfect one, but the key is we strive for excellence in everything we do. It's the wound healing process that really gets in the way. But we want our patients to have a good result, and I think that's the difference also. And we work every day to be better. So what are your take-home points for our viewers now? I think you hit the nail on the head on so many things about revision rhinoplasty and how you can find a board-certified rhinoplasty surgeon. He or she is a facial plastic surgeon or a plastic surgeon that has expertise in this area. And I can't overemphasize that. You got to have expertise, especially in revision rhinoplasty. You just can't say, okay, I do 10 rhinoplasties a year. I mean, my goodness, these are such complicated procedures. You have to have somebody that does it every day, thinks about it every day. So what are your take-home points for the consumer about revision rhinoplasty? Let's just say they're looking to have a redo rhinoplasty. Obviously, look at the social media, but just take it with a grain of salt. And of course, look at those consumer ratings, which of course are very objective, but look at all the positive stuff. I agree with that. So what else, Dean, do you think are important for them to look at?
I think it's helpful to look at whether or not your surgeon or your potential surgeon is an educator. I really believe that when we go to a meeting or we're invited to a meeting, we're there for a reason. It's because our peers see us as an expert.
Right.
And we're going to teach the other doctors how to do our operation when it comes to rhinoplasty. That is a lot. That says a lot about someone's capabilities. I mean, if you're teaching the other people and your peers in a specialty on how to do the operation, that should go a long way, in my opinion, because I have tremendous respect for a lot of the people that I listen to at these meetings. I learn a great deal from them. And I have tremendous respect for them because I see their results. I know how good they are. And I know that their techniques are solid. And so I want to emulate them in many ways. And so if someone is an educator, I give them a tip to their hat, because they work hard to teach other people. They refine their techniques, and they've gained respect of their peers. There's no better way, in my opinion, to know who's an expert based on how their peers look at them.
Yep, I agree. And I will tell you, that's one of the secrets of medicine, because good doctors know good doctors. And when you're on the faculty at a meeting, you're pre-selected by your peers. So there's no better and more rigid group of people that will judge you, right, Dean, than your own peers.
Absolutely.
I mean,
Absolutely.
you think social media is bad. Your peers are the toughest. No, they are. And
no, you're right. And that's right. That's the way it should be.
Yeah, no, I agree. So the smart patients know that. They'll come in and say, hey, I've read your articles. I see what you've done. And I think that's good. And you're right. Nobody's perfect. But that's some wise words. And I think those are some of the wisest words actually from this podcast. So know before you go, when you're looking for revision rhinoplasty, you need to have a top-level revision rhinoplasty expert like Drs Toriumi and, people like that. I mean, there's only a few of us, unfortunately, in the United States that actually do this operation. And in fact, you and I get referrals all the time from excellent other rhinoplasty surgeons. And that's fine, because, to me, that says, listen, I do a good rhinoplasty, but I don't do a good revision. And that's fine, too, because I respect those people, don't you? If they've done the
absolutely, absolutely. There's a huge difference between being real good at primary than being real good at revision.
100%. And we all know
many times the people who are really good at primary, as they develop, they'll get better at secondary, but it takes time. That's where the experience factor comes in.
Right. And I agree. And I get a lot of those patients like you do, Dean, and I'll tell you, I respect that a lot. And because it's a lot of hard work, toil, and pain. Suffering. But all right, know before you go, wise words from Dr. Drs Toriumi from Chicago. And please leave us your comments and questions. If you have any comments or questions, please let us know. And remember, the goal is to help you become a more educated and smart view, and to help you find the right surgeon for you, whether it's a rhinoplasty or revision rhinoplasty. So again, Dean, thank you so much. Really enjoyed having you today.